wake up in the middle of the night, your mouth feels completely dry, like sandpaper. This sensation, which we call xerostomia, affects nearly 30% of adults over 65. Most people ignore it, thinking it's just aging. But today, in this medical masterclass, I'm going to explain why this is actually one of the most important health signals your body can send. It's a signal linked to your heart, your blood sugar, and even your risk of malnutrition. Stay with me, because we are going deeper than ever before into the science of your oral health. Let's start with Chapter 1, the medication multiplier. Over 400 common drugs list dry mouth as a primary side effect. But the real issue after 60 is polypharmacy, taking multiple medications at once. If you're on just one drug, your risk of dry mouth is 37%. But for the 40% of seniors taking 5 or more medications, that risk jumps to nearly 80%. We are talking about anticholinergic drugs, the ones for blood pressure, urinary incontinence, and depression, that effectively unplug your salivary glands. They block the muscarinic receptors that trigger saliva production. If you take oxybutynin for your bladder or an SSRI for your mood, you are 6 times more likely to experience severe dryness. This isn't a minor annoyance. It's a systemic suppression of your mouth's natural defense. Chapter 2, the diabetes signal. For many of my patients, dry mouth is the first clinical indicator of type 2 diabetes. When your blood sugar is high, your kidneys work overtime to flush it out through urine, a process called polyuria. This dehydrates every tissue in your body. But it goes deeper. Chronic hyperglycemia leads to autonomic neuropathy. This means the nerves that control your salivary glands become damaged. In some studies, patients with an A1C over 9% showed significantly lower saliva flow compared to those with stable levels. Your mouth is the dashboard for your metabolic health. If it's dry, we must check your glucose. Chapter 3, the sleep apnea paradox. Over half of adults over 60 have some form of obstructive sleep apnea. When your airway collapses, your body defaults to mouth breathing, which evaporates moisture in seconds. But here is the challenge for my patients on CPAP therapy. The machine itself can be the cause. Nearly 45% of CPAP users report severe dryness. Air leaks through an open mouth or incorrect pressure settings can turn your treatment into a source of discomfort. Remember, untreated sleep apnea is a major risk factor for heart disease and stroke. If you wake up with a dry mouth and a headache, your sleep health needs an immediate review. Chapter 4, Sjogren's syndrome. This is an autoimmune condition where your immune system mistakenly attacks your moisture-secreting glands. It's not just aging, it's an internal battle. It predominantly affects women in their postmenopausal years. Unlike medication-induced dryness, Sjogren's often comes with Sika syndrome, dry eyes, dry skin, and profound fatigue. Diagnosis often requires specialized serological tests for anti-SSA or anti-SSB antibodies. It develops slowly, often masked by other age-related symptoms, but its impact on your quality of life is profound. Saliva isn't just water. It's an immune fluid, and without it, your oral microbiome enters a state of crisis. Chapter 5, the clinical consequences. Dry mouth is more than a feeling. It's a precursor to decay and malnutrition. Saliva neutralizes acids and remineralizes your enamel. Without it, you face rapid root decay and gum disease. But for my older patients, the biggest risk is dysphagia, difficulty swallowing. When you can't produce enough saliva to form a food bolus, eating becomes difficult, and your risk of aspiration pneumonia increases. This can lead to silent weight loss and malnutrition. We also see a spike in oral thrush, candidiasis, because the balance of bacteria in your mouth is destroyed. We must treat the dryness to protect your ability to nourish yourself. Chapter 6, the treatment protocol. We move beyond just sipping water. Recent research has shown that 1% malic acid sprays can stimulate saliva without damaging enamel. We also use sialagogues like pilocarpine for those with remaining gland tissue. But the most important step for you is a scheduled hydration protocol. Because your thirst reflex, the obtunded thirst, dulls with age, you must drink water on a schedule, not just when you feel thirsty. Review your medications with your doctor, ask about Sika symptoms, and prioritize oral hygiene. Your mouth is a signal, and now you have the knowledge to respond to it. This masterclass was designed to give you the tools to take control of your health. Dry mouth is manageable, diagnosable, and treatable. I want to hear your story. Have you noticed a difference since starting a medication? Write reset in the comments if you're starting a new hydration protocol today. I read your comments to help guide our future medical deep dives. Stay healthy, stay informed, and I'll see you in the next Master Edition.